Hi, everyone, and welcome back to the Caregiver Empowerment Program. Today's webinar will be on bipolar disorder, and we'll be focusing on an introduction to bipolar disorder. My name is Alexandra Ferreira, and I'm a senior clinical psychologist at Nua Healthcare. In today's webinar, an introduction to bipolar disorder, we'll be providing helpful information in relation to this mental illness. This webinar has been divided into two different parts. Part 1, an introduction to bipolar disorder, and Part 2, an introduction to bipolar disorder, how can you help? In Part 1 of this webinar, we'll be providing helpful information about bipolar disorder, its symptoms, and how mood can change for the individuals who have this diagnosis. We will talk about the functional impairments that can result from this disorder and the evidence-based assessment and intervention procedures currently used in clinical practice to support managing associated difficulties and preventing long-term implications. In Part 2 of this webinar, we'll be looking at important steps such as how someone can know that they have bipolar disorder and what is involved after being diagnosed with bipolar disorder. We'll also look at additional resources, helpful books and information on relevant support groups, as well as guidance on where to seek additional supports in the community. This webinar is suitable for caregivers supporting those who have bipolar disorder and mood difficulties. Throughout this webinar, in Part 2, we'll be covering a series of topics, and these include what does bipolar disorder look like, mood in bipolar disorder, what are the risk behaviors people with bipolar disorder engage in, what can contribute toward mood episodes, how does bipolar disorder impact a person and those around them, and then we'll summarize it all after reviewing the content of this webinar. So what does bipolar disorder look like? Bipolar disorder is a serious mental illness that consists of unusual significant shifts in a person's mood, in their energy levels, activity levels, concentration, ability to carry out daily tasks, and behaviors. A person's mood can change from periods of extreme highs and elation, which is what we refer to as mania, to intense lows and despair, which is what we refer to as depression. These changes are designated as mood episodes, so manic episodes and depressive episodes. When a person is experiencing a manic episode, they may feel euphoric, full of energy, and unusually irritable. When their mood shifts and they enter a depressive episode, they may feel sad or hopeless and lose interest or pleasure in most activities. These episodes can last for several days or even several weeks. People will experience different symptoms depending on the mood episode that is occurring. So, as mentioned in the slide before, we have manic episodes and we have depressive episodes. So, what are the symptoms of a manic episode? Feeling very high, up, elated, or extremely irritable. Feeling more active than usual, so jumpy, wired, restless. Decreased need for sleep, talking fast about a lot of different things, which is what we refer to as flight of ideas, and that they just come in and out very fast. Racing thoughts, feeling able to do many things at once without getting tired, excessive appetite for food, drinking, sex, and other pleasurable activities, feeling unusually important, talented, or powerful. Sometimes the episode is so severe that a person may develop psychotic symptoms, and when a manic episode is present, hospitalization may be required. People who experience manic episodes commonly experience something like the following. It's like being on a train that's speeding down the tracks and it's going faster and faster with no conductor, no brakes. And at first, the feeling is very thrilling. The scenery is rushing by you. You feel alive, powerful, unstoppable. You have endless energy and everything seems possible. You might feel like you're on top of the world, full of big ideas and grand plans. And you might feel like, You're moving very fast. You barely need to sleep because who needs to rest when you're so driven like you're feeling right now? But over time, the train keeps on speeding up and past all the warning signs, past safe limits, and you can't slow it down. Others may be worried, but from the inside, it feels exhilarating or even normal until things derail, with consequences that you couldn't see or didn't believe would happen. This just shows the level of excitement and lack of controllability that someone that is experiencing a manic episode goes through. So, that was an analogy to kind of understand and illustrate what it's like to experience a manic episode on feeling so good while everything is falling apart and other people can see it, but the person themselves is not aware of it. So, people that experience a depressive episode will experience very different symptoms to those that are experiencing a manic episode. So, some of the symptoms that we have observed are feeling very down or sad or anxious, feeling slowed down or restless, trouble falling asleep, waking up too early in the night or sleeping too much, talking very slowly, feeling unable to find anything to say or forgetting a lot, trouble concentrating or making decisions, feeling unable to do even the simplest of things, lack of interest in almost all activities, and feeling hopeless or worthless or thinking about death or suicide. So, in comparison with our unstoppable train that people that are experiencing a manic episode feel when experiencing a depressive episode, it's a lot like walking through wet cement. So, for this analogy, I will use wet cement. Imagine waking up and feeling like you have to walk through cement or wet cement all day long. Everything feels very heavy, your body, your thoughts, even simple tasks like getting out of bed or brushing your teeth feel like monumental efforts that need to be made. Your mind might be telling you that nothing matters, that you're worthless, and that things will never get better. Even when you want to do something like talk to someone, go outside, or eat, you just feel like the energy or motivation just falls out of you and you're unable to complete it. It's not laziness. It's like the world is gray and you're stuck, you're sinking deeper with each step, unable to move forward. And it's like there's this pressing energy just pushing you back. So, that is what some people who go through a depressive episode may describe as being part of their experience. And as you can see, it is completely the opposite of what someone with a manic episode experiences. And people with bipolar disorder, particularly bipolar disorder 1 or type 1, experience both of these episodes in fluctuating ways, as we will see in the next few slides. Mood in bipolar disorder. As mentioned previously, consists of unusual and significant changes in a person's presentation, particularly with regard to their mood. This is the primary indicator of mental illness, particularly in disorders such as bipolar disorder. Mood fluctuations are often accompanied by other symptoms outlined previously, and they may present in different ways depending on the individual, their particular mood pattern, and symptom severity. In bipolar disorder, the most common pattern found is the fluctuation between manic and depressive episodes, where each one is present during a specific period of time before the individual shifts onto the other side of the spectrum. As we can see on the graph there, the pink corresponds to manic episodes and the black corresponds to depressive episodes. And the person is just fluctuating and shifting from one episode to the other. That's not to say that there aren't periods of baseline mood between each episode, but the fluctuations that we commonly see in bipolar disorder would be very similar to those that are resembled in this illustration. Sometimes people with bipolar disorder can experience both manic and depressive symptoms at the same time. This is called an episode with mixed features. So, when this happens, both pink and black are occurring at the same time, and the person is actually fluctuating in that moment between feeling very sad, empty, or hopeless, while at the same time feeling extremely energized and no need for sleep at all. So, this would be what a mixed episode or an episode with mixed features looks like. However, we more commonly see the one where people fluctuate between a manic episode and a depressive episode. Additionally, a person with bipolar disorder can have few or extreme symptoms in that these are less severe. Particularly in the case of manic symptoms, these are the same for both manic and hypomanic episodes. The difference between manic and hypomanic episodes is that hypomanic episodes are less severe symptoms. Um, so instead of having a manic episode, then the individual will have a hypomanic episode. During a hypomanic episode, a person may feel very good, be able to get things done and keep up with daily life. They may feel like they can do anything. They feel like nothing is wrong, but their family and friends may recognize a change in their mood, activity levels, and behaviors. So, without proper treatment of hypomanic symptoms, these can go on to develop into more severe symptoms, constituting then as manic symptoms. This is then what we constitute or call as bipolar disorder type 2, where there is an alternation between mood episodes, yes, but it would be hypomanic episodes, so less severe symptomology in the manic episodes. That's why the curve is smaller. And also, then they'll have depressive symptoms as well, so depressive episodes too. So there's still the fluctuation, but particularly with regard to the manic symptoms, the severity of symptoms it's much reduced. People will experience so again, different symptoms depending on the episodes that they are experiencing, so either manic or depressive mood episode. With regards to hypomanic episodes, the symptoms are actually the same as the manic symptoms. The only difference is the severity. They're much less severe. So if we look, people will have a tendency to feel very up, high, elated, or extremely irritable, feeling jumpy or wired, more active than usual, decreased need for sleep, talking fast about a lot of different things, racing thoughts, feeling able to do many things at once without getting tired, excessive appetite for food, drinking, sex, or other pleasurable activities, feeling unusually important, talented, or powerful. Because of the reduction in the severity, we see that the individual, in contrast to the manic symptoms, we do not see here the presence of a predisposition or the likelihood of someone experiencing psychotic symptoms. So that is something that is different when we look at a hypomanic episode in contrast to a manic episode. And the other difference is that hospitalization is usually not required in a hypomanic episode unless, again, the symptoms go untreated and they become more severe, transforming into manic symptoms and a manic episode. So, bipolar disorder is a serious mental illness that consists of unusual and significant shifts in a person's mood, energy levels, activity levels, concentration, ability to carry out daily tasks, behaviors. If an individual experiences fluctuations between manic and depressive episodes, we call it bipolar disorder 1. If the individual experiences fluctuations between hypomanic symptoms, so less severe symptoms of mania, and depressive episodes, then this is what we call bipolar disorder 2. What are the risk behaviors people with bipolar disorder engage in? Bipolar disorder can be characterized by fluctuation in mood, which may be accompanied by thoughts of grandeur and feelings of power in manic episodes, on the one hand, or bleak thoughts toward the self, others, and the future, accompanied by feelings of sadness and worthlessness, on the other hand, if it's the case of a depressive episode. In either case, individuals are often more predisposed to engage in impulsive and risk behaviors when experiencing these thoughts and emotions. Common risk behaviors observed in individuals with bipolar disorder include reckless driving, excessive spending, gambling, drugs and alcohol abuse, unsafe sex, impulsively quitting their job, self harming behaviors, and suicide. So we see a lot of risk behaviors and impulsivity increase, and it doesn't really matter which episode they're experiencing, the increase to engage in these risk behaviors and impulsive behaviors is the same across both types of episodes. However, it is important to note that in a manic episode, due to um, the racing thoughts and due to the energy levels, we find that the individuals engage in a lot of activities, not necessarily completing them, but they engage in a lot of activities, and they think about engaging in a lot of stuff. They want to get rid of that energy that they're feeling. So there might be a higher propensity to engage in a behavior without thinking through the possible consequences that may come from that behavior. For example, reckless driving. What can contribute toward mood episodes? As we already have learned, people with bipolar disorder are not always experiencing a mood episode. They have periods of stabilized mood. In these times, they're likely to present with regular adaptive functioning skills as well. So they're able to function within what is expected to be a normal range without any implications when their mental illness is under control. So, what is it that sets them off and sends them off into a mood episode, be it manic, hypomanic, or depressive? Some factors that may trigger a mood episode include stress, accompanied by poor stress management skills. This can be an acute, upsetting life event like the loss of a loved one, or a buildup of daily stressful experiences like continuously being stuck in traffic and late for work. Physical illness, change in sleep schedule, stopping medication, unresolved childhood trauma, alcohol drug consumption, changes in the weather. So there are multiple factors that can influence a person that might result in them developing or falling within a mood episode. A lot of the times, and that is why it's the first one, stress is very important to manage in the context of mental well being. And this is not only applicable to bipolar disorder, this is applicable to all mental illnesses in general. The more stress someone is experiencing, the more likely they are to experience mental deterioration. In the case of bipolar disorder, mental deterioration is experiencing a mood episode, which is a relapse. But we can also see that changes in sleep can lead to that as well. Stopping medication, using alcohol and drugs. The reason for that is because bipolar disorder is a very neurobiological illness, in that there are elements in the brain structure and the neurochemistry in the brain that, if it is not regulated, it can lead to someone relapsing in the context of their diagnosis of bipolar disorder. So, when we look at the strategies on how to support someone with bipolar disorder, we're going to see that the regulation of the body, the regulation of the circadian rhythm, so sleep, and making sure that the body and the mind and the neurochemistry is regulated is highly important to keep someone well and prevent relapse in bipolar disorder. How does bipolar disorder impact a person and those around them? The impacts of bipolar disorder will vary depending on the severity of symptoms and whether or not a person is experiencing a mood episode. Many individuals with this mental illness return to be fully functioning between their episodes. However, in general terms, mood episodes in bipolar disorder can be extremely debilitating and impact a wide range of domains in a person's life. For example, from an occupational functioning perspective, people are less likely and able to manage tasks related to self care and house management due to constant jumping from one thing to the next, or depressive and lethargic state in the context of a depressive episode, more likely to have financial difficulties, etc. From an interpersonal functioning perspective, due to being hard to predict, mood patterns and the increased instability around one's own presentation when not treated, many people with bipolar disorder struggle to form and maintain long term relationships, so many times lacking a social network. From an educational and professional performance perspective, there is a high dropout rate of younger people with bipolar disorder due to the mental, cognitive, emotional, and behavioral implications of the mental illness. It can prove to be challenging to maintain a full time job, as they may fluctuate significantly in attendance and productivity levels, particularly if they are experiencing mood episodes. And in terms of quality of life, generally they are of lower socioeconomic status due to the impact of the illness on their professional performance and increased morbidity associated with prevalence of risk behaviors during episodes. The impacts of bipolar disorder are not limited to the person with the mental illness. They also affect carers, family members, and friends negatively. Common impacts on carers, family members, and friends include emotional distress, so feeling guilty, feeling grief, feeling very worried about your loved one, disruption in regular routines, having to deal with unusual or dangerous behavior. Again, that's due to the high increase in risky and impulsive behaviors that may occur, particularly in the context of mania. Financial issues as a result of reduced or unstable income or excessive spending, changes in family roles, health problems as a result of prolonged stress, strained marital or family relationships, difficulty in maintaining relationships outside of the family, just due to how much time and the distress that living with someone and caring for someone with bipolar disorder has on an individual. So, in summary, in part one of this webinar, An Introduction to Bipolar Disorder, we talked about its symptoms and how mood can change for individuals. You should now have a greater understanding of what bipolar disorder is, mood episodes in bipolar disorder, the risk behaviors people with bipolar disorder engage in, what can contribute toward mood episodes, how bipolar disorder impacts a person and those around them. Coming next, we will discuss in part two, An Introduction to Bipolar Disorder, How Can You Help? So join me next in part two. Thank you for your time and your attention during today's webinar. We hope you found it helpful. Should you wish to add structure to your caregiver routine, please refer to the sample tools and third-party resources associated with this webinar, which have been conveniently uploaded to your learner area of the learning management system. Please keep in mind that these are only samples and that with your newly acquired knowledge, you may choose to use them in whole or in part or research alternative resources and tools yourself. If you have any questions in relation to any of the topics or areas raised during today's webinar, please feel free to contact our team by emailing clinicaldepartment@nuahealthcare.ie. Thanks and see you in part two.